Hi, I'm Dr. Wendy Coren, and I am an equestrian healthcare provider. Primarily what that means is I work on both the horse and the human to create balance and give them each the best ride possible. One of the tools I use in doing that is Kinesiology Tape. And what that does is when taping a body, either a horse or a human, you're able to lift up the fascia, stimulate the mechanoreceptors underneath the skin and within the skin, so that you're sending muscle messages to the brain, and the brain is then knowing where the body's supposed to be in space. We call that proprioception. The more aware you are of where you are, the better you can perform. What we do is, by taping the body, you're able to set it in a correct position, which then fires the muscles correctly, and then the body is able to more completely connect with the horse and give the horse the directions that you intend to do. Riders will often use their front muscles so much that they'll come forward. So one of the taping techniques we use for our riders is to bring the shoulders back and tape the right front over to the left hind. What that does is, as the shoulder falls forward, it'll bring it back to keep the body in balance. This is not a restrictive tape the way you would use athletic taping to immobilize. This is informational taping. It tells you where your body is, and it also stimulates the skin so that any discomforts that have been there are overwhelmed by a more pleasant sensation rather than an uncomfortable sensation. Same way as if you get stung by a bee, you'll rub it in order to send a pleasure sensation to the brain rather than the stinging sensation, calling that rub it better. So as you put it on, the muscles that were then tight are getting lymphatic drainage, pleasure sensations up to the brain, and awareness in space. We make sure always that the body's in the best possible position from the ground all the way up. We have the arms relaxing at the side. We have the head retracted so the ears are over the shoulders. You have you shrug the shoulders up, roll them back, and drop them down. So we have the scapula even, and this is the kind of posture that we want to keep during the entire riding time. We measure so that each side is taken care of with the same message. We want the brain to be getting left side, right side. We round the edges of the tape, and the number one reason you round the edge of the tape, so it doesn't get stuck on things and it stays on longer. This tape can stay on effectively 4 to 5 days with showering, with all normal daily activity. We never, ever, ever stretch the ends of the tape. That causes irritation to the skin. We just hold the body in the correct position and then allow the tape to connect right front, straight through, gently applying it so that it's just creating awareness all the way down from right front to left hind. And then we tuck it in right over there, which we'll do after the fact. Okay, again, making sure that humans don't change their positioning, starting in the front, making sure that there's no pull whatsoever. We can feed it through, and then grab the back of the tape and just allow it to very gently move through. Horses are easier because they don't wear clothing, and we'll show you that after the fact. And then we can take this, tuck it under, making sure again that there's no stretch on the bottom, and that's simply to avoid any irritation. Right there at the bottom of the skin. Trimming it before, trimming it after, it doesn't matter. Okay? So now what we have is, in a relaxed posture, shoulders level, scapula level, and if this comes forward, proprioceptively sending a message in through here. The tape can be used for posture. The tape can be used for pain. If there were a muscle spasm or a pain from a pulled muscle, a pain from a bite, a kick, an inflammation, the tape can also be used to eliminate that pain by, this time, adding stress. So if there were pain right here on that vertebral segment, we would open it up like a Band-Aid, stretch it over the pain area, and apply it with no stretch on either side. And what that does is lift the fascia up, increase blood flow, increase lymphatic drainage, and again, send a pleasure message so that an area that is typically painful would become non-painful. An area that was bruised would allow that coagulated blood to flow out of it and improve the healing time dramatically. So with no toxicity, nothing taken in, you can help pain, you can help posture, and this is effective to keep the rider in the best possible position so that they're connecting with their horse and actually giving the aids that they need to give. One of the most amazing uses of kinesiology taping that I found in my practice is not just taping areas that have a problem, but taping entire fascial lines, because as most equestrians know, the head bone is connected to the tailbone, that the horse works as an entire being, and working with fascia lets us know how connected that really is. So you can feel it with your hand when you palpate that the horse will actually have what we call a paniculus response and show that all these areas are connected. What we find is that that's because there is interference along that flow along the fascial train. What kinesiology taping does is it will lift the fascia up, allow the fluid dynamics to improve so that you're increasing the flow, the glide, the ability of the fascial planes to slide over each other, decreasing pain and increasing movability, mobility, and we know that by allowing the connection, you get the hind end to connect with the front end, which is going to give you a more powerful and a more accurate experience in your riding. So one of the ways we can tell does the horse need any kinesiology taping is to see when you palpate if you see reactions outside the area that you're touching, and I'm touching with a fingertip. So we see that. We know there's some form of interference within that fascial communication. So we take the tape, hey honey, we introduce the horse to the tape, we measure out along the entire portion of that fascial plane. In his case, we're going to do the medial segment of the superficial dorsal line, which starts at his head, yes, and we get approval, and goes all the way down to the coffin joint. We're going to take the part that's most reactive, and we're going to tape that and see what it does for him. When taping, the same rules apply for the horse as they do for the rider, and that is you round the edges of the tape. The reason you round the edges, it gives you a smoother surface so that it stays on better. It doesn't affect anything else other than the length of time you're taping is going to stay on. We've seen it stay on as long as a week. We've seen it stay on as long as an hour. It depends upon the combination of the horse and the weather conditions, all of that. What we have seen though is that you can get results within minutes of applying it. The rules are the same again, horses and humans. When applying any form of kinesiology taping, you never stretch the ends. It irritates and pulls on the skin. But what we do is we stretch the animal. So we ask his body to come up. As that stretches his skin, we apply the tape. stretch the skin. And apply the tape. One last time. We're going to stretch the skin and apply the tape. One of the things you can see right after you finish taping is that if you palpate the same area and dig in the same way, look what happens to the fluid dynamic. You already see that there's no paniculus, there's no reaction along that entire fascial plane. Just to show you, I can even palpate outside the area that's taped, because once you change that fluid mechanism, it changes along the entire fascial plane. We've found out, as of research that was done last year, that there are 7 planes that exist in the horse, going along the top line, going along the midline, going along the front, going along the back of the front legs, front of the front legs, and actually spiraling around. All of these can be taped to help improve performance, as well as local areas, fetlocks, suspensories, any joint space can improve movement by lifting the fascia and improving the dynamics of that specific area. Right now, the research is just beginning, so the usefulness is pretty much endless, and we're just starting to know. One thing we know for sure, makes them feel better right away. When we first began, both sides of this horse were reactive. After taping the right side, we already found that most of the reactiveness on this side has gone, without one small exception in this intercostal area. The reason we're going to tape both sides anyway is because in order to create the best balance in your equestrian athlete, you want to tape both sides so the same information is getting to the brain, and the brain is actually listening to both sides of the body equally. So in this case, we're going to tape a little differently. We're going to start with our beginning not having any pull on it, but we have one area of pain rather than an entire fascial line of pain. So we're going to not use any stretch, come to the area of discomfort, which is right there, and not only are we going to stretch the skin, but as we come to that area, we're going to put a little bit of a torque, stretch the tape right there, and what that does is it actually increases the lift of the skin right here where he was tender. Notice we have no reactivity whatsoever in that intercostal space. One thing with taping, and this is very important, if you tape correctly, you see results immediately. If you don't see results immediately, take it off and do it somewhere else. You can't hurt anything that I'm aware of with it, but if you're going to be helpful, you're helpful right away. There's so many different areas and techniques you can do. We know here, this worked. If it hadn't, I would have taped it this way. I would have done it differently. Feel free to experiment. You can only help.